Give some folks a little time. Hello, good evening. Welcome. Welcome to Protect Your Village. Welcome. Awesome. We're going to give folks at least 2 more minutes to join our lives today. We're super excited to introduce some really, really valuable resources from University Health tonight. So I am going to wait just a minute and a half more, and we'll get this event started. Thank you for joining us. Awesome. We have our comment section is wide open today. So if you have questions and comments for our panelists or our moderator or for University Health, please feel free. This is a safe space for teachers and school administrators. We're going to give you another minute to join the conversation. No question is a bad question here at the Protect Your Village Facts versus Fears Town Hall. So feel free to drop questions, comments, emojis, and we'll have some really, really cool ways to interact with the brands right here in the comment section. Welcome to Protect Your Village Facts versus Fears Town Hall, hosted by University Health on TAN TV. This is our second town hall. Previously on Sunday, we hosted a town hall solely and specifically for our church leaders and congregations. So we're really excited to open up this resource for teachers and school administrators. Are you all ready?
Yes.
Awesome. My name is Christian Reed Agba. I am the founder and the principal publicist of ECHO Public Relations. Before we asked our guests to share their perspectives, I wanted to make sure that we got into our viewers and let them know just why we were hosting these town halls. This is the second of 3 town halls that we'll have live virtual town halls to answer questions about the COVID-19 vaccine, as well as introduce resources from University Health. There are efforts to promote the vaccine, but we are pushing these town halls because we need more efforts solely focused on the Black community or Black and Brown communities or people that service Black and Brown communities, like our teachers and school administrators. We've created some high-level information for you on GetVaccinated.sa.com as a way to dispel issues, historical issues the Black community has had with our healthcare system, and especially with vaccinations. Transparency seems key to trust building. When Black people have greater information about how vaccines work and how they are developed, they have greater willingness to take vaccinations. Therefore, our messaging should be open, honest, and comprehensive. If you find that we are not being that, go ahead and leave a comment in the comment section.
Go get some.
Can we get some muting? The negative correlation between Black identity and vaccines intentions suggests that education efforts should work to acknowledge the harm that historical vaccination efforts have caused, notably the Tuskegee syphilis study, while making pointed connections between core values within the Black community and the benefits of vaccinations. Specifically, efforts should aim to highlight how vaccinations can save Black lives and strengthen Black communities. This conversation we'll host today will give teachers and school administrators the tools that they need to instruct their students and answer questions that their students and families within their schools may have. We want to be able to provide an open source opportunity for teachers and school administrators as well as parents in an effort to keep their schools and their families safe. So without further ado, I am going to introduce you to Laura Thompson. She is the founder of TAN TV. She will be your moderator and your host for this evening. And take it away, Laura.
All right, thank you so much, Christian, for that very special introduction. I'm Laura Thompson, as Christian indicated. I would like to welcome and thank our panelists for joining us tonight. And before we get started, I'm going to acknowledge you individually. So if you're not speaking, if you would mind keeping your mics off, so that we won't get feedback. So good evening. How's everybody doing this evening? So we would like to welcome our panelists. Our first panelist, Dr. Shawana Chambers. She's an educator, and so she's going to be giving information in regards to education in schools. And we have Dr. Tommy Austin. She is a senior vice president and chief executive chief nurse executive at University Health. And so welcome, Dr. Austin. Thank you for joining us. And then we have Stephanie Whitehead. She's the executive director of pathology services for University Health. And so we're super excited about you all joining us this evening. So getting educators and students vaccinated against the coronavirus that causes COVID-19 is a crucial step in return to normal for schools. But a lot of hurdles and questions remain regarding how and when this will happen. So now I will ask you, each of our guests, to take a few minutes to offer their perspectives of the COVID-19 vaccine and how this has affected our education system. And I would like to direct the first question to Dr. Shawana Chambers.
Sure, thank you. So obviously we know, right, what's been going on this past year and the extreme stress that having to do the hybrid model and being out of school and outside of our typical situation, our typical norms has had on both our families and our students' mental and physical well-being. And so one of the things I think is really exciting after hearing about, okay, we've got this vaccine, we can start taking this vaccine, great, we're gonna roll this out and everyone's gonna get it. I think it's provided some renewed hope that not necessarily will return to normal, but that we can start to get on the right track and get back to what we love doing, which is seeing students in our schools, seeing them in our classrooms, being able to, to engage with them in more than a digital and virtual setting. So we're just really excited. And I think that's why it's very important for us to have forums like this to dispel any rumors or any misunderstandings about the vaccine so that people can feel that hope, right? And can feel that desire to go back to schools and see each other and be able to engage in like just fun life activities that we had before. So yeah, I would say the biggest thing is the vaccine has provided more hope for us to be able to see our kids again in a different sense.
Well, thank you for that answer. And so I wanted to direct the same question to Dr. Tommy Austin. Could you offer your perspective of the COVID-19 vaccine and how this has affected our education system?
So I deal with medical education, nursing education, and how the vaccine has impacted that is it has allowed for the medical professionals, students to go and have clinicals again. Before we had the vaccine, it was delaying their academic achievement. And so the vaccine has allowed them to not only participate in vaccinating the public, but also has given them the opportunity to finish their degrees. And so to me, that is a major hurdle. And personally, I have a 13-year-old nephew, and what I've seen with the vaccine, I have hope that he will go to class one day because not every child is a virtual learner. And so I have seen a lot of difficulty with a lot of kids having issues with virtual learning. So my wish for the vaccine is that it's used in children under 16 soon so that they can be back in the classrooms.
Thank you for that, Dr. Austin. And so the final panelist, Stephanie Whitehead, I would like to direct that same question to you. If you could offer your perspective of the COVID-19 vaccine and how this has affected our education system.
Similar to our other panelists, I run a very large operation here at University Health System, and we've been able to see the effects of having the kids doing a hybrid model of virtual learning, how that has affected our healthcare workers who are already very stressed as they take care of the patients here at the hospital and as we respond to the city's pandemic. And so I think having a vaccine will help give healthcare workers with children some relief. I myself have an elementary school student, And I've seen the changes in her as we've tried to do elementary school virtually. It has not been easy, but I've enjoyed the partnership and the increased activity I've had with her teachers. However, I think, she does miss that camaraderie she has with her students. And it has been a very difficult time for my family, just like others. In addition, the laboratory community and the laboratory workforce has been scarce even before the pandemic. There's been a national workforce shortage of clinical laboratory scientists for a while. And with the pandemic, some of the students who were in a clinical laboratory program had to stop their rotations. And that stopped the flow of candidates that were coming out of a graduating class and able to work in laboratories. And with the number of COVID tests we're having to perform, in addition to other laboratory tests we do on a daily basis, that has been very impactful, especially as we have a large force of retiring clinical laboratory scientists, as well as people who just leave the field because of burnout. And so, like the other panelists, this gives me hope that we will be moving to a brighter side of this pandemic very soon.
Okay. My next question is directed to all of the panelists as well. So the question is, what were your thoughts and feelings before and after you took the COVID-19 vaccine? And I'm going to direct that first question, the first panelist, Dr. Tommy Austin.
Well, I had a lot of mixed feelings when I first learned that we were able to get the vaccine. Pre-vaccine, I couldn't even sleep the night before. I was so anxious about and excited about receiving the vaccine, because for me, it gave me a lot of hope. It gave me hope that we could have family reunions, go to church. I can tell you, I love virtual church, but I'm tired of virtual church. I want to go to church and listen to some good old gospel music and really, really enjoy serving the Lord. So for me, before getting the vaccine, I was very, very fearful, and I always masked, and I still do. And I'll tell you, none of my habits have changed since I've received the vaccine, because right now they tell us I had the Pfizer vaccine, so they say we're 95% effective after 2 weeks of receiving your second dose. They don't know how long that lasts. There's more research that needs to take a course to find out how effective is it in long term. And so for me, the vaccine gives me hope.
Great. So I'm going to direct that same question to Dr. Shea.
Yes, I would say prior to the vaccine, my biggest reasons for choosing to get vaccinated was, one, my grandmother who lives with me, just wanting to, in any way that I could, reduce the likelihood of her being sick in any way. I was on board, right? I just need to do this. And then also wanting to contribute to herd immunity, right? Like wanting to be someone who helps make it safer for people who couldn't get the vaccine. So that was, I think, I was definitely like worried, right? About, okay, it was kind of fast, but like what happens, what am I going to do? But those are my two big things, right? And that was, I know I'm going to be protected. I'm okay. I'm just going to go, I'm going to put it on, I'm going to get it. So I also have the Pfizer one. And outside of being tired for a little bit, that was it, right? Like that was all, that I experienced. And then I was back, right? Like doing whatever I needed to do. And so I also haven't changed many of my things. I still like go to work, come home. That's pretty much it. But I also feel like I am contributing to something bigger, right? Like public health is very important. And because I am able-bodied and can get this vaccine and can do what I can to help others, I think that was a big deal for me. So I'm glad that I got it. I'm proud that I got it, because I do feel like I am making a difference in somebody's life who couldn't get the vaccine.
Wow. Well, thank you for that answer. And Stephanie Whitehead.
Sure. There was never a doubt in my mind that I would be getting the vaccine when the opportunity was given to myself to be able to be vaccinated. I feel that working in healthcare and being so close to our pandemic response and working so closely with the physicians and clinicians that are treating these patients, that it was a duty to be able to do that, to help give some type of relief to the healthcare system that have been so strained over the past year since this pandemic started. I, of course, have the family members and friends that have that wait and see mentality, that we're going to wait and see what happens with this vaccination. And obviously hesitation amongst our community, especially, is completely reasonable. I totally understand that. However, what I've told people is the vaccination is really our key as an African American community to decreasing the disparity that COVID-19 has had on our community and the impact that it's had on our family members. Really, if we can vaccinate, and we can vaccinate at the levels that we need to as an African American Latino community, we can decrease the number of infections, we can decrease the number of deaths that are impacting our community more disparately than others. And so for me, I had my own personal experience contracting COVID-19, and I know that many of my friends and family look to me sometimes as an example because I do work in healthcare. And I felt like it was important for me to set that example with getting the vaccination and showing people that it was completely safe and that it was my duty to keep myself safe and my family safe.
Wow, well, thank you for that, Ms. Whitehead. So this question is directed to Dr. Shea. Can a school district require an eligible educator to receive the vaccine?
So right now, the current COVID-19 vaccination is only authorized via the emergency use authorization. So it's completely voluntary in terms of your choice to get the vaccination. However, once the vaccine is formally approved by the FDA, then employers could choose to require it in order for, to require all of their employees to get the vaccine. So right now, no, because it's authorized under the emergency authorization. But once it's authorized by the FDA, yes, an employer could choose to require it.
Okay, so this question is directed to you again. So this month, Texas teachers and child care staff are now eligible for the COVID-19 vaccine. Do you think teachers are hesitant about getting the COVID-19 vaccine? And if so, why or why not?
So in my experiences and in my conversations that I've had, I know a lot of educators, right? I don't know millions, but I know a lot of educators. And many of us are vaccinated already, right? We're either vaccinated or we are sharing information on where to go to get vaccinated, or like just trying to support each other, find that. So I don't feel like teachers are more hesitant or less hesitant than anyone else. In fact, to me, that's the opposite, right? Because part of, if you follow anything on social media and follow a lot of educators, the biggest issue that people had was initially it wasn't available to a lot of teachers and they wanted it. So now that it is more, widely available across the country, we'll see even more educators going to get it. But I don't feel that educators are more hesitant, right, than someone else to get that, because we know what the impacts have been to our students of them being virtual. We know what the impacts have been on our families. And so we want to do, whatever we can to better support our community. And again, herd mentality herd immunity is a thing. So as many of us can get it, that's great.
Oh, well, thank you. And I have one other question for you. It's a follow-up question to that. So knowing that kids under 16 cannot get the vaccine, how can we best protect our students and our school staff in face-to-face education settings?
Sure, good question, loaded question. So I will mention that the Biden administration has pledged about $130 billion to supporting a reopening plan in K-12, all of the K-12 schools. And those funds would be used to, one, reduce class size, because obviously we want to be able to social distance and have fewer students in classrooms, to be able to modify spaces to comply with social distancing, to modernize HVAC systems. That's a big deal because we have a lot of our school buildings across the country are older. Right? Like they've existed, especially public schools, they've existed for a really long time. And so maybe they need to be modernized to come up to code or up to date, right? And then also to hire additional school custodians, to hire additional nurses, counselors, to just facilitate the ability to socially distance in schools. And so Oh, and then also for transportation, right? So ensuring that we have more buses, that we hire more drivers so that we can socially distance better on school buses as well. So the money would go to supporting all of these tactics. And so with that, you see a bigger likelihood that we can create these safeguards that ensure that teachers and staff and students feel protected, and that they have the protection that they need to be able to come back on campus and learn face to face.
Wow, well, thank you so much for that. So this next question is directed to Dr. Tommy Austin. When will kids?
Give me one
be able
second,
to
Laura,
get the
let me
COVID?
jump in. Hey, Laura, really quickly, we have some comments in our comment section pertaining to the school question that Dr. Shea just answered, and we're so grateful. So this means because we have to have so many different precautions, the question is, would people have to go through different trainings in terms of making sure that the schools stay safe and that the schools are clean and the teachers really stay up to date on their social distancing rules?
Yes, you would need to train, right? If it's a change to the typical environment of a school, like pre-COVID, yes, you need to train people. You need to have documentation in place that has been, like, you've gotten this information from University Health, you've gotten it from our local, boards, you've gotten it from the WHO, the CDC, et cetera, so that we can make sure that we're using the most up-to-date scientific information. So in a school district or in a school setting, you would create these trainings so that your custodians know how to properly sanitize and clean, right? So that your teachers know what's the process, what are the steps, and also that students have to know too, because you are asking them to socially distance, you're asking them to commit to herd immunity and all of these other pieces. So you would have to do some type of training or professional development in the school so that everyone is very clear on what the expectations are.
That's really good to know. Thank you so much for that answer. In the comment section, if Dr. Shea responded and you're happy, give us some thumbs up. We really want to get that interaction from you. And while we're talking about schools and students, I do want to mention that Our Culture Matters will be giving you $250 Amazon gift card to the school that is mentioned the most in the comment sections of this live feed. So only while we're live right now, so only until about 6:30, you can win $250 gift card for Amazon for your school. Just mention your school in the comments. We got Roberta here tallying them up, and we will be able to announce that closer to 6:15. All right, Laura, that's all the questions that I have right now. So back to you.
All right, thank you, Christian. So this question is directed to Dr. Tommy Austin. When will kids be eligible to get the COVID-19 vaccine?
So children under 16, it's still unknown when they will receive the vaccine because the different companies are still doing testing on young children. So right now, the three vaccines that we have, Pfizer, the limit is 16 years old, and the other two, Johnson & Johnson and Moderna, are 18 years of age. And so as soon as we get enough research that is validated, then we will have information in regards to when we can give vaccinations to children under 16 years of age.
Okay, thank you for that. This next question is directed to Stephanie Whitehead. So why can't children use the current vaccines?
Sure, that's a really good question. And it really goes back to the nature of how vaccines are developed and how they're researched and tested. And so although none of the vaccines that are out right now use a live virus, they do use genetic material from a virus that still trigger your immune response. And because children have different immune systems than adults, it hasn't really been tested in them. And even using a small amount of the vaccine could be harmful to them. So just like Tommy said, there are some researchers all over the country, especially at the CDC, doing some very important work, making sure that they are submitting a lot of data to the FDA to make sure that they can develop a vaccine that is safe and appropriate for children of all ages under the age of 16.
Oh, thank you for that. So Dr. Tommy Austin, so in some places, school employees are getting the vaccine, but not the members of their families because they do not have access to the vaccines. Can someone still transmit COVID-19 even if they've been vaccinated?
Yes, they can, because they can be asymptomatic and they can still have the virus. And so that's why it's so important that we continue to wear a mask, do hand sanitizing, and the social distancing. So yes, you can still spread it even with the vaccine, because again, the research has not shown to us how long the immunity lasts. And so as we get more and more research results, we'll have more definitive information. And so it's very important that we continue to stick to the standards of the Centers for Disease Control.
Okay. And so I'm going to ask you another question. So we've heard a lot about the 1A and the 1B recipients. Can you define who the 1A and the 1B recipients are?
So the 1B are, it depends on what state. And so I'll tell you the classification that we use. 1B was school teachers or anybody that worked in healthcare, anybody that worked in schools, anybody that worked in close proximity in a nursing home. And whereas 1A was that really frail elderly population, they were the first to get the vaccination. So that's the categories right now, but soon we will be at 1C, to where everybody who is at the age eligibility will be able to get the vaccine.
Another one, Dr. Austin, you might be able to answer this one. Is the booster different from the initial dose?
The booster is very similar to the initial dose, especially with the Moderna and the Pfizer. Right now, Johnson & Johnson is not requiring a booster, but I'm sure they're continuing their research to determine whether or not a booster will be effective. So right now, the most effective shot is the one you can get in your arm. So if someone offers you a vaccine, just take it. Because we get that question all the time. Which shot should I take? Anyone that you can get.
Okay. So Stephanie Whitehead, what happens if the second dose is delayed for some reason?
For some reason, if your second dose is delayed, we encourage you to get the dose as quickly as possible. There are windows that are appropriate for each shot. I believe the Pfizer is 21 days and Moderna is 28 days. Sometimes those times can be delayed. However, we encourage you to reach out to, your officials or wherever you're getting the shot, talk to them and get the second shot as soon as possible. Don't skip it, because that second shot is really important for you to get the effectiveness of the full immunity that the vaccine offers.
Okay. So I'm going to direct this question to Dr. Austin again. Could someone get a different vaccine if that's available when the time comes for the second shot? Like if they got Pfizer, could they get Moderna for the second shot, or how does that work?
Well, we really don't encourage that. I guess in a crisis situation, we could do that. And I think Stephanie would be the better respondent for this, since that's her field of science. But what we've have expectations of people that come to Wonderland and get the vaccines from University Health is that they get the second vaccine as soon as possible. And it's the same as the first vaccine that they've gotten. So you get a card, it tells you which vaccine that you've gotten. If it's Pfizer, then you get the Pfizer booster, like Stephanie said, in 21 days. And if it's Moderna, then you get the Moderna booster in 28 days. For Johnson & Johnson, it's just one shot.
Okay. Could you add on to that, Stephanie?
I agree completely with Tommy. I would suggest that anyone in that situation go to get some appropriate information, either from your PCP, your primary care physician, or get vaccinatedsa.org, or you can call University Health System to request more information. It is not recommended to mix the vendors of the shot right now. However, as more information comes out and more studies are done, the things may change in the future. So it's always great to get the most updated information and talking to a health professional if you're in that situation.
All of these are really, really good answers. I'm just going to chime in really quickly. The comment section is still wide open. We haven't had a lot of mentions of those schools. So make sure, teachers, if you're watching, to please share this with your networks so that we can make sure that your school wins big on that $250 Amazon gift card. Also, we're putting some other things in the comments for teachers, especially. When we were planning these town halls, we really had to sit down and come to the table around all of the content and information around these vaccinations. And we found some really cool videos. So teachers, feel free to go into those comment sections and look at the community immunity videos that we've shared. They present a very fun way to students of what the COVID vaccine does, as well as how it's made and what to expect after you receive it. And then how to talk to your family and to your friends. It's put to music. It is very, very interesting. So thank you so much for tuning in. Share this with your teachers' networks. I'm gonna let the experts have it. Laura, back to you.
Christian. So since we've been talking about the booster shot and the second shot, so Stephanie, so what happens if a person does not get the second shot?
Well, nothing happens. It's not recommended, but nothing will happen. Really, to get the full efficiency of the vaccination, which, like we mentioned before in the panel, is between 90 and 95%, you need that second dose. Without that second dose, your vaccination immunity is about 50 to 80%, I believe. And so really it's recommended by the vendors that you take the dosage in the appropriate amounts and get that second shot.
Thank you,
But
Stephanie.
nothing happens if you don't get the second shot.
Okay. So do you have anything additional to add to that, Dr. Austin?
No, Stephanie answered it appropriately. Nothing happens that we're aware of at this time, but again, it gives you the best immunity when you take both vaccines.
Okay, thank you. So while I still have you, Dr. Austin, should pregnant women receive the vaccine?
Yes, and the way you should do that is to go to your PCP and have that discussion with your physician and talk about the risk and the benefits. And in most cases, the physician will want you to have the COVID-19 vaccine because we have seen in the literature that the vaccine passes on some immunity to the baby. We're not quite sure how much, but in some of the studies that have been done lately, the baby has received some immunities. And so it's best to have some immunities rather than no immunity. So yes, but always talk to your physician first.
Okay. And so I have an additional question related to individuals that have had COVID-19. And that's some question about whether or not they should take the vaccination and at what time. So can you expound on that, Dr. Austin?
Yeah, so there's several schools of thought in regard to when to get the vaccination. If you've had COVID-19. If you've received convalescent plasma, and again, Stephanie, I think it should be right in your realm since you're our director of pathology. I'm saying everything she would say, so I'm just going to pass it to you, Stephanie, because that's your field of science.
I'm going to tell you, like I mentioned before, and just put myself out there, that I have my own personal experience as the vaccine was being rolled out with getting a COVID-19 infection. And it was still very important for me to get the vaccine because the words that we use with COVID-19, this is a novel virus. People don't know very much about it. The research is not there. And just going through my own personal experience, it was very difficult, very scary. And I wanted to do everything I could to not only continue to protect myself, because our natural immunity, the timeline of that is still unknown. We're still doing research on if you have natural antibodies from getting an active infection, how long you will be covered for that. To get the vaccine, not only to continue to protect myself from a future infection, but to continue to protect the people in my household, because others in my household did not become infected as I did. And basically understanding that, like I said, vaccination is the way that we can help protect our community, people in your phone, the people that you love, the people that you're hanging out with every single day. That's how we can make sure that, as we mentioned before, we continue to give ourselves hope that this will end very soon, that we can get to a place of normalcy again, and that we can get to a place where we're able to be together and congregate.
Okay, I'm going to break in really quickly because Dr. Austin, you have sent me down the rabbit hole with the two words convalescent plasma once before, and I did my own research. And I am not a Stephanie Whitehead, and I'm not a Dr. Austin, and I'm not a Dr. Shay. You know, I know you all know this, and you all know the community and where we've come from in terms of how we understand the practices of vaccinations. So, in my understanding, convalescent plasma it may be the basis for a lot of vaccinations that we receive across the board. Am I right? We got some head shaking. Yes. So people, especially people in the minority community, have been using the convalescent plasma industry as actually a method of income for some years, right? We see that. We've seen that plenty of times. People that are a little less fortunate utilize plasma donation as an income source. So this vaccination is safe to probably say, maybe and meticulously maybe, that this vaccination comes from the very people that are kind of sketchy about it. Am I wrong or am I right? Right now we can have a conversation. Stephanie, tell me I'm wrong, but then at the same time, tell me I'm going somewhere with this.
What I would say is that, you know, like I said before, the hesitance to get the vaccination, especially in our community, is completely understandable, particularly with what's happened in our culture. You can mention Henrietta Luggs, you can mention, like we said before, the Tuskegee Institute. What I'd like our community to know now is that there are so many safeguards in our government that protects people like us from those things happening again. So there's so many, and Dr. Austin, I can kick this back to her to talk about all of the regulations when you want to do research that they have in place, and then all of the different data that needs to be submitted to the FDA before you can put anything in place. And so we can understand right now that we are safeguarded as much as possible for those things happening again. Also, I will say for those nurses that are working very hard at the Wonderland Mall, when you approach them to get your vaccination, they are thawing out a vaccination and putting it in the next person in line. It doesn't matter what race, color, or creed they are, everybody is getting the same vaccination. There's not a different vaccination for African Americans than Caucasians. We're all getting the same vaccination. So I think it's important to understand that, yes, convalescent plasma has been an important tool for us to aid in helping people who have a really bad infection with COVID-19 get better, but also the vaccination is what's going to help us continue to keep each other safe.
And just to share, convalescent plasma is someone who's had the disease, who shares their plasma with the community. And so that's why it's called convalescent. And I just wanted to add that, Stephanie. I know you're the science guru here. So
well, you're the nurse one now.
I wanted to share that because I know, like you said, some people use plasma as income, but that's because you can give plasma more times you can give blood. And so convalescent plasma has been a good thing for our community. And I've seen it really help patients turn around when they've had COVID-19.
We're literally talking about protecting our village because, I mean, if that's not the definition of protecting your village, it takes a village. If we do not have the people that are able to get well and to let science do what science does best, and that is find answers, find resources, and present them to the public. So thank you so much, ladies, for giving us those good answers. I want to ask another question. I'm sorry, I'm tuning in again. Dr. Shay, as we see schools open back up and we see students go back into the schools for in-person learning, do you feel that there's going to be a time where, you know, those little immunization cards not being filled out might be a bigger conversation than just being, hey, I don't want to get this very old vaccination versus this new COVID vaccination is here. It's a mandatory situation. Do you feel that there's going to be more alerts around the vaccination requirements for schools?
I can't say for sure yet because there's still so much information we don't have, right? And it's still voluntary for adults, right? So I don't foresee that happening in the next year or so in terms of like requiring it for students to register for school or to come back. I feel like there will probably still be a push for we really encourage you to do this, right? Like this would be really great for the community. But I haven't even heard conversations around we're going to make the COVID vaccine a requirement in order for students to enroll in school.
And what about for parents to enter schools or to visit and things of like that nature? Do you foresee that, or will that cause too much of a traffic jam?
That would be really difficult to do, right? Like I don't know many schools right now that require vaccinations from parents to volunteer as it is, right? So I think that would just be really hard to manage. I can't say for sure what will come in the future, but the operations and logistics of that would be really difficult, especially because we don't, schools don't do that right now for people to come in the building.
Awesome. Okay. Thanks so much for those answers, you all. I'm going to send it back over to Laura.
Thank you, Christian. Well, we're talking about schools, Dr. Shea. So you talked about your classroom sizes, or the students it's going to be less students in the classroom, correct?
Yes. I was going to say yes.
How do you?
Did.
So if all the kids came back to school, decided that we want to come back and be physically in school, so how do you accommodate the same number of students if there are less kids in the classroom?
So that is where school districts have to be very strategic and very creative, right? So if a classroom typically has 30 in a room and you're saying that we want to cap it at 20, well, you have to figure out where those 10 extra students are going to go, right? So that might mean repurposing rooms that currently exist as like storage facilities or testing, right? Like you have to, the district, or purchasing modular buildings. Now you might have more portables, right? If you have to create space because you can't have the same number of students in a class that you could pre-COVID, right? We've said social distancing, right? But when you look at what the state, like TEA, the guidance around social distancing for public schools looks different, depending on who you talk to, right? What entity you're dealing with, right? It's 6 feet, unless you can't do that. And so then you could do something else, right? So I think that's an expensive thing that we're going to have to figure out, right? Are we going to be putting more modular buildings on campuses? Are we going to be investing in additional buildings to make sure that we maintain whatever the ratio we want in the classroom? It's definitely not something we can solve quickly because the impact is monumental just in Texas, right? The number of school districts, and in San Antonio, we have 17 different districts, right? Not counting charters, not counting private schools and all of these other entities. So it's a lot of money. And so that's why, people are pushing for federal money to come in and support with this, because it's going to take money in order for us to create smaller classrooms and to hire more people to clean and do all of these things that we need to do to protect students and staff.
Well, so in terms of virtual schools, so how are y'all going to juggle between like virtual and physical attendance?
You're asking a tough question. So right now, the state, or at least in Texas, we get funding for remote students, right? We have not heard from TEA whether or not they are going to fund virtual students next school year. Right? So districts and charters, we can't make a decision right now about what's going to happen the next school year because we need to hear from the state on whether or not they're going to count virtual students as present. If they do, then schools will more than likely offer parents the opportunity to stay virtual or remote, if they want to for the next school year. But remember, the state of Texas funds public schools based on attendance. We are an ADA state. That means average daily attendance. So in order for your school district or charter to get money, your child has to come to school. If the state says we are not going to count virtual students as present, that means the school is not going to get paid for any virtual student, right? But we still would have the same amount of teachers that we have to staff the schools. We still have to provide the resources and the instruction to students, but we wouldn't have that money for any student that's virtual. So that's going to have a huge impact, right, on what school looks like for us in 2021, 2022. But we can't really make that determination until the state of Texas tells us, yes, we are going to fund you for any student that's virtual. Right now, what we do, what most schools are doing, or I say most, but like probably just about all of us, are doing some form of hybrid where they might have a teacher or a group of teachers that are only teaching virtually and teaching all of those students. And we've got teachers that are teaching students face-to-face. In a lot of instances, we have teachers that are doing both simultaneously. They are teaching students virtually and students face-to-face at the same time. It's hard. It's very hard. It's exhausting. It is contributing to teacher burnout. It is not something that we want to continue doing next year. So what we encourage is put some pressure on the state of Texas, right? To tell us that, yes, we are going to fund your students who are virtual the next school year. Otherwise, kids will have to come back to campus or parents will be homeschooling.
Wow. So that $130 billion that is allocated, does that go into effect now, or this school year, or this school semester, or does that start in the fall?
So it's been pledged. Not sure when that, right? There's always a period of time between hearing about it and then when the money is actually dispersed to schools. Right. So what we would love is for that money to come before the end of the school year. Is that likely? Not sure. Right. So we can hope that it will be in place for the summer, or that it will be in place going into the new school year, because if we're still virtual, that still means lots of student tech. Right. That means lots of infrastructure upgrades for schools that need to be able to manage the bandwidth, the number of students and devices that are going to be on, when they're on campus. So yeah, we would love that money sooner rather than later, because it impacts budgeting. And this is about the time that districts and charters are starting to budget for the new school year and figure out what are we working with, what do we have. And that's why we really want to know from the state, are you going to pay us when we have students who are virtual? Because that impacts everything.
All right, state of Texas inquiring minds want to know. So Christian.
Yes, ma'am. All right. This is getting really good. I just want to remind everybody that we're live in 3 different places right now. We're live on 10.tv. We're live in the Facebook event page, as well as we're live on 10 TV's Facebook page. So we're reaching audiences across a number of different platforms. It's so good to have you all with us tonight as we discuss the COVID-19 vaccine and how teachers and school administrators can work to keep not only their families, but their schools and their students and their students' families safe as well. In the comments, if you're watching any of the comments right now, University Health is in these comments, you all. That means you have access to not only these amazing experts you see on this panel, but you also have access to University Health persons. So go ahead and pose a couple questions directly to them. I'm actually getting questions on my text. So whoever is sending me text message questions, what do we have these platforms for? But I'm going to go ahead and pose this question, and if we can answer it, we can answer it, or if we can use it to make a solid point as to why everyone should get the COVID-19 vaccine as soon as possible, let us do that. The question is, how much does COVID-19, how much does it cost? What is the average stay? What is the average cost of a stay in the hospital if you are diagnosed with COVID-19 versus the very free vaccine? But okay, there's no possible way we know, because we have different, pre-existing conditions, right? So Dr. Austin or Stephanie, give me an ideation of what can make your stay a little bit longer, what can make it shorter, and then we'll tell everybody else what can make you not have a stay is getting the vaccination. So Dr. Tommy.
So it's very difficult to quantify, but I've seen patients be in the hospital up to 3 months. And they're on very expensive treatments such as ECMO, and where they have renal replacement therapy, and they're on a ventilator, and they have one-to-one care in most cases. I'm not going to give you a dollar figure on that because, you know, life is priceless. However, it is very expensive to take care of a patient with COVID-19 that has in full exacerbation rather than getting the shot, which is free to the healthcare facilities and to the public. You want to add anything, Stephanie?
No, that was very comprehensive. All I would say is, you know, what is your alternative? You know, your option is to get the shot or to risk getting the virus. And when you get the virus, nothing could happen and you can be perfectly fine and recover, or you could have one of these very serious bouts of the illness, as Tommy mentioned. Or, as we mentioned earlier, you could be fine, but you could pass that infection on to one of your family members or loved ones, and then they could have a very serious reaction or a course of that infection. And so when you think about this in terms of cause and effect, you know, what is your alternative to not getting the vaccination? It's to risk getting COVID-19 and passing that along to a loved one who may or may not make it, because everybody's experience with this virus is very different. And we know that as, you know, African Americans, there's a myriad of reasons why there's a disparity of how this infection attacks our people in our community. But we do know that there are comorbidities that we are more susceptible to: sickle cell anemia, you know, high blood pressure, diabetes, all of those things that make the COVID-19 infection more strenuous and more stressful on our bodies. So you can be okay, or you could have a stroke and not be able to see, or not be able to walk, or not be able to talk. And so those are things you need to consider versus a very easy vaccination.
Exactly. Thank you so much for that. We still have our comments open. We still have some concerns in the comment section, and that's reasonable. It's very reasonable to have a space, have a safe space where we can share our comments and we can share our questions as well as our concerns. And so thank you so much, Dr. Austin and Stephanie, for those responses. COVID-19 can be extremely expensive. It can cost, like, you can't put a dollar figure on a life. So it can cost us a very big generational issues though. So we want to make sure that we really optimize what it is we have to offer. If you got the most golden healthcare plan and you can feel free to suffer 3 months in a hospital, I'm still going to tell you to get the vaccination because it's a great investment. I'm just going to go ahead and say that. At the same time, right now is a time where we can change the way in which we interact with the healthcare industry, and we can interact with our experts and really learn about things that are keeping us safe in terms of being utilized and being protected and being cared for. So I really appreciate those comments. Thank you so much. And thank you so much to our University Health family for allowing us to help get this message out to our audiences. It's extremely vital that we care for our audiences by our community by over-informing us. The more information we have, the more access to information we have, the better decisions we'll make, right? So getvaccinated.sa.com is a free resource University Health put together to help educate the Black and Brown community around the pros and the myths and the facts. And yes, talking about some of your fears of the COVID-19 vaccine. So visit getvaccinated.sa.com right now, today. We're gonna have Roberta put the comment in the section, and we're gonna have University Health, they're gonna probably put it in the section. We're gonna make this a trending topic. If you have someone in your family that doesn't really understand and you really can't get it out as to why you care about them so much, and you don't wanna have a couple of arguments, go ahead and send your family and your friends to getvaccinated.sa.com so they can get their questions answered and get the care that we all deserve, right? So our giveaway is still underway, but we're going to wrap this in just a few moments. You know what? I don't want to make any executive decisions and start calling out the schools that I love and appreciate, but I am going to say I'm tallying up, and Roberta is helping me tally up all of the different comments in the different spaces, because we are live in 3 different spaces. We're trying to capture the largest audience that we can, and we're tallying those up. I'm gonna come back in about 2 minutes. I think, Laura, you got 1 or 2 more questions. I don't see a lot of new questions. Oh, look, we got some more community immunity links posted in our comment section. Teachers, go ahead and download that. And if we have a couple more questions, hold on, give me a second. Ooh. Oh, they're green. They can't see them because of the green screen. Ah, that's cool. Okay, so we do have a question here. And it is, how does the vaccine work if the virus isn't even in it? Right? This is an mRNA question. I studied this also. Dr. Austin, I think this is for you.
I'm gonna pass that. That's science. That goes to
Oh,
Stephanie.
okay, Stephanie, let's go ahead.
I don't think I can
Well,
explain it as well as she could.
Well, it's Christine just said it. It's an mRNA question. And so the mRNA is basically the genetic material in a virus that is basically the map that delivers to your cells how to respond in the immune system. And so I think where some people tend to get confused is a lot of the vaccinations that we get today, rubella, mumps, even the annual flu vaccination, has an element of either an inactivated virus or a weakened amount of the actual virus. And so people think, oh, okay, well, that's what's in the COVID vaccine. They're going to give me COVID. And that's not true. What's in the COVID vaccine is the genetic material, basically the mapping. And then that mapping goes to your cells and tells your immune system how to respond. And it kind of mimics having a COVID response. If you get a couple of symptoms from having the vaccine, that means that your immune system is working. The vaccine is doing what we want it to do, and that you're gathering that coverage and that immunity that you need towards the COVID-19 virus.
Thank you so much for that one, Stephanie. Appreciate you. And here's another one. Why is there a COVID vaccine injury program set up on the CDC website? Who can handle that one?
There have been some allergic reactions, but no one has determined whether or not scientifically the individuals had issues prior to getting the vaccine, but they want to account for any illnesses, deaths, or whatever in regards to getting the vaccine so that the public can be informed and so that people can feel comfortable with getting the vaccine. It's part of the informed consent, and part of getting informed consent, especially when it's under emergency use, is that you share that information. And so, like we were saying earlier, when you have an investigational review board, which I have been part of, you make sure that the one thing that individuals understand is what they are taking. And so part of our responsibility is to make sure we read that and we help interpret it for our peers and our family members.
Thank you. Thank you for that. See, the CDC website has a ton of information on it. And just to have that injury program set up, just to have that opportunity to go in and give feedback, even if you have a great experience, this organization is a learning organization. So they're going to constantly be looking to create and renew the information that they receive. So that's a precaution. I love that that's a precaution. I feel like it's keeping us a little bit safer that they have that precaution. We have a question here. What are the long-term effects of a shot or of a vaccination that has a 98.3% recovery rate? So I'm guessing that they are looking to know what are the long-term effects if we'll figure that out. If you're that person that asked that question, go ahead and expand a little bit. But do we know our long-term effects right now, Dr. Austin?
We don't have a lot of data that tells us how long the immunity is going to occur. We're doing the science and providing the vaccine at the same time. And that's because we've had so many deaths in the world. And so people have to be patient and have to be open-minded that the rigor of science is occurring, but no one can give you a definitive answer on that.
Yeah, that's honest. Thank you so much for that transparency. We've had plenty of deaths around the world, too many to count. I believe in the States, we're looking at a little bit over 500,000. In Bexar County, we're rounding around 5,000 almost. We're maybe getting up to 5,000. And that's just too many. I want to help our students stress that, their lives matter, their individual understanding of the COVID-19 vaccination, as well as how COVID-19 affected our 2020 year is very much important as well. So Dr. Shea, talk to me about how students are going to really digest this information. Is it going to be added to the curriculum that within a year we lost 500,000 people, and that for years to come, we're probably going to have to take these precautions? How do you suggest teaching this moment in history?
Y'all ask real hard questions for
So
education.
sorry.
So yes, children, I think one of the things we all as adults need to recognize about children is that they pay attention. Even if they don't ask you questions or they don't say anything to you, they have the World Wide Web available at their fingertips. So they know, they're researching, they're reading. Sometimes they'll come and be like, hey, I read this thing, is it true, right? So that's actually one of the reasons we should be talking to students about this, because they're gonna get the information from somewhere. And you want them to be using information that is credible and not just what somebody just threw on the internet, right? So that's one thing. We as adults should be having these conversations with children, even little ones, about what's happening, right? Because we now have children, preschoolers, who've not been out in the world, who have only ever been home with their families, right? Like, so they don't have that socialization, that engagement piece that would be typical for a childhood experience. They're going to be coming to school or going to these other places for the first time. And that's different, right? We need to account for the mental health effects that our students have and are currently dealing with as a result of extreme isolation and a lack of regular social interaction. And seeing what's happening within their communities, the disparate impact that COVID-19 has had on the Black and Brown community, right? That has an effect on children. So we have to be talking about these things. You asked, like, what will we be doing when we teach about this? I feel like it's definitely going to be in science and biology coursework. Like, we would be remiss if we didn't revise curriculum to include this. It should be in, well, I will say I don't speak for Compass Rose, but being like chief academic officer of Compass Rose, I will say, like, we are opening a school, right? With a specific specialty in public health administration, right? Specifically born out of COVID-19, right? And how do we educate our students in Black and Brown communities, so that how do we empower them to know about public health in a way that they can become advocates for themselves and for their community, right? So yes, you're gonna have schools that crop up as a result of this, right? To focus on what we've learned, what it means when we talk about the human condition and all of these things. But yes, we would have to adjust the curriculum. We've talked about it in our curriculum now, right? So part of a curriculum, yes, you adopt one or you purchase one, but you have to adjust it to the needs of your students. So that means when you find that a good chunk of your students, or there's a trend of kids asking this question or wanting to know this information, as educators, we have a responsibility to create space in the classroom to teach, right, and to engage so that students can learn. So there will definitely be long-lasting impacts via curriculum, via the structure of school, how we do school scheduling, right? What's virtual, what's not, the push for blended learning, like true blended learning, because what we did this year was not blended learning, right? But all of these things are going to be impacted and are impacting our students. But the one thing that I can't stress enough is adults should be talking to children about what's happening right now. You ignoring it doesn't mean your child's ignoring it. They're talking about it with somebody online. They're talking about it with each other. They're reading about it. They're watching YouTube videos. And it is our responsibility to make sure that we teach media literacy, that we teach children what's accurate and what's not, right? How to detect information that's biased and information that does not bring with it all of the limitations and says upfront, these are the limitations of this right now. Like, nothing is ever perfect, But being able to acknowledge what the limitations are is really important. And that's a skill we have to teach our children. And there's a lot of disinformation around COVID-19. So this is also a good opportunity to teach rhetoric, right? Like to put that into our English classrooms and our history classrooms, right? And the way communities have come together and supported each other versus how states have responded, how they've responded by ethnic group, how they responded by race, how they responded by class, who's had access to vaccination, all of these things, right? This should all be in our curriculum. This should all be in our public schools, in our private schools, in our home schools, all of it. Because our children are going to grow up and be adult citizens who vote, who are the lab scientists, who are the RNs, who are the people on the front lines, who are the educators, who are the politicians, right? And we have a responsibility to use this information and what we've learned through COVID-19 to make us better as a community and as a country.
Thank you. Riveting answer. So spot on. And to think that Conference Rose, I'm really proud of that. It's considering adding public health and into the curriculum. That is phenomenal. I remember in 2011, after 9/11, was that 2011 or 2007? After 9/11, we saw all of those students that graduated high school go and become firefighters and become first responders. And you see how that really shaped the way in which they saw their futures. You know, that issue, that tragedy really shaped the way in which they saw their futures and the career choices that they made. So look out, Stephanie, Ms. Whitehead, and Dr. Austin, you're gonna have a couple of mini mentees coming up real soon as these students learn how to really affect the change. It starts with them. It starts with them making decisions shaped around their experiences right now. So I appreciate your answer to that question, Dr. Shea. That was riveting. Okay, so we're rounding out at 6:22, and we are so grateful that you all stayed with us this entire time. I am going to say thank you so much on behalf of University Health. My name is Christian Reed Agaba from ECHU Public Relations, and this has been the Facts versus Fears Town Hall. Laura is going to actually take us out, and I just want to say I'm grateful. I am so very grateful for the responses. Back to you, Laura.
All right, thank you, Christian. And that was a great answer, Dr. Shea, spoken like a true educator. We appreciate those comments. And so before we close out, I had just a final question, and I want y'all to just respond in about 30 seconds. And we didn't talk about the mask, and I wanted to know how important it is to still continue to wear the mask, even after you've had the vaccine, and why. Dr. Shea?
Okay, so I wear it because I haven't had a cold in over a year. I'm just recognizing all of the things that we did pre-COVID. We just shared stuff we shouldn't have been sharing. So I've got a collection of masks. They are nice. I will continue to wear them because the vaccine doesn't mean you can't still catch or transmit, right? So we keep the mask to still keep our stuff to ourselves. But that's my non-scientific answer. I like not getting sick. So the mask has been very helpful for me.
And Dr. Tommy Austin, she's the mask expert.
I can share that with wearing the mask, we've seen a reduction in flu. And so normally this time of year, I would have already had the flu, whether or not I've had the vaccine or not. And so we have seen a severe reduction in the flu, which I am very happy about. And for children, respiratory virus syndrome has decreased. And so kids are healthier from wearing the mask, and adults are healthier from wearing the mask. And so just because we are starting to get the vaccine, we don't have herd immunity yet. And so that's why it's so important until we get to 70% or greater that we must continue to wear a mask at all times. If they're not in your village, then they need to have a mask on.
Thank you, Dr. Austin. And Stephanie, what do you have to say about it?
I absolutely agree. The science is being constructed right now in this real life scenario. We are collecting the data as we go. The research for the vaccination did not account for people no longer wearing masks. And so until we have all the information we need about how to properly protect everybody from this virus, we still need to do the social distancing, wearing our masks, washing your hands, and all the things that we've continued to do that has kept us all safe so far. So I wear my Tommy mask with pride, and I will continue to do so. And me and my family will continue to do so until we get to a place where our community is safe. And if you're not going to do it for you or your family, I would listen to the educator and the healthcare officials on this call who have talked about the burnout of the nurses, the burnout of the people doing the COVID testing and giving the vaccine, the burnout of the teachers, and all the toll it's taken on our community. So if you can't do it for yourself or your family, do it for the community, because this virus has definitely taken a toll on all of the frontline educators and healthcare workers.
Wow. Well, this has been a great conversation with lots of great information. So I hope that everybody is taking this information at heed and going out and executing the things that you learned today in this panel discussion. So I wanted to thank University Health for hosting this event. It's very important that our healthcare community gets involved in it and gets behind it, which they have, and they will continue to do. And so we want to thank them for hosting. We would like to thank ECHU Public Relations for organizing this discussion and this town hall meeting. They had a lot of foresight, and it's important that this information get out, and they are experts at doing that. And so thank you for organizing this wonderful panel. And I just wanted to say off script that this is Women's History Month, and we have a panel of powerful women and experts in the healthcare and education industry. And so we salute you and we thank you for, staying on the front line and staying on top and providing great information for our communities. So I'm going to turn it back over to Christian. Do you have any final remarks?
I really don't. I think what I'm going to do, because I just didn't get enough schools. I don't feel comfortable. So here's what we're going to do. We're going to roll this over for 24 hours. Share this as much as possible. Your comments are still very relevant. Your questions are still very relevant. We're going to make sure that those questions get directly to University Health. If they're not already answered, on getvaccinatedsa.com. But we're going to make sure those questions get directly to University Health. And if you keep mentioning your school, if you start mentioning your school, I'll be tallying up until 6 o'clock tomorrow, and I'll announce that live on our Culture Matters page. Thank you so much, Laura. Thank you, TNTV. Of course, thank you so much to University Health for helping us get this information out to our villages. And thank you so much to Dr. Tommy Austin, Dr. Shawana Chambers, and Stephanie Whitehead for joining us and sharing your knowledge. And we appreciate your time. And yes, it is Women's History Month, so let's give it up for the ladies, because we done came together and saved the people, okay? Congratulations, you all, for a great evening. Y'all have a good night and stay safe.